So thank you, Tracy and Justin. I want to briefly thank my instructors for their flexibility in this unique situation, and as well as my classmates for allowing me to do this presentation remotely. So one of the main aspects of natural family planning is for women to assess their cervical mucus throughout the course of their cycle. There are variations in the consistency and coloration and amount of the discharge throughout the menstrual cycle, and this has become an important aspect to be able to know periods of times throughout the period when you're fertile and not fertile. Next slide, please. So just the basic physiological background on the mucus characteristics. The glands within the cervix secrete mucus, and mucus consists primarily of water as well as other proteins and carbohydrates and lipids. And a protein of interest is mucin, which has carbohydrates attached to it which are charged, which can interact with each other, form a gel lattice, and increase their surface area and kind of bind up the water and all the other factors mentioned and create this mucus plug, which is an impenetrable barrier into the cervix. And just a note, within the vaginal canal, most women experience dryness. Some women experience some wetness during this time in their cycle, and that's due to minor defragmentation of the cervical mucus plug, but still while maintaining that barrier during this stage. Next slide, please. So this is an image analysis of different characteristics of discharge women can experience. So on the left-hand side, you see this thick, creamy, very tacky, however you wish to describe it, discharge that this woman is experiencing, which is not very favorable for sperm motility and fertilization. As you gear towards fertilization during your cycle, excuse me, you notice the consistency changes to a little more stringy-like, a little more translucency, as you approach ovulation. And this is very important to teach your patients about how this transitory phase is coming, and now you're more likely to be fertile, and you want to begin to abstain from having sex. Next slide, please. So now what's happening is you get the formation of an egg. Estrogen stimulates the mucus to break down by stimulating proteases and sialidases, etc. So now the discharge changes its characteristics, and new mucus is being secreted, which is more of this stringy, more translucent type of discharge, and now the plug therefore is disintegrated, and a woman now is more likely to conceive with that lack of that mucus plug barrier. Next slide, please. So as we learned from Dr. Baker Townsend's presentation a couple weeks ago, the cervical mucus really is the train that can help transport the sperm to fertilize an egg. And the type of consistency now is called it's sort of like an egg white consistency, or it's also been called a spin barquette. Next slide, please. And so now the consistency is sort of more clear, very wet and stringy and stretchy type of mucus. It's very similar to an egg white. So it's important, again, for the woman to be able to discriminate between the different textures and colors to kind of help use that as a gauge throughout their menstrual cycle. There are factors that can impact this mucus, such as antibiotics or feminine cleaning products or other medications. So it's important to know your patient and have them be aware of those differences. Next slide, please. So there are methods now based off the cervical mucus monitoring, the Billings ovulation method, the Creighton model, and the 2-day method, and we'll get into each one of those briefly. Next slide, please. So the Billings ovulation model was developed by Dr. John and Evelyn Billings, and they have a charting system that kind of tracks your cycle. So there's color codes, there's symbols and stamps, etc. So on the left-hand side of the slide are just examples of some of the charting that you would do. So red means stop. You're having menstrual bleeding. Do not have intercourse at this time. Green means go. You're most likely infertile. You're going to have dryness, vaginal dryness, due to the mucus plug formation, and it's okay to have intercourse. And there's other examples presented. But as long as you have the four main tenets of this method learned by your patient, it has a very high success rate, and you can read those on this slide at hand. Next slide, please. So here's an example of one woman charting through the Billings ovulation method. I'm not going to go into all the details of it, but for example, the red, you can see the red, there's menstrual bleeding, there's the baby stamp when she's deemed fertile. I means intercourse, so this woman had intercourse those specific days is marked, and so forth. Next slide, please. And this slide has nothing to do with contraception per se, but it's just a tool that you can use to continue to pique interest in any of your patients if you deem necessary. And basically, it's just an example of using the Billings ovulation method in real life. So to make a long story short, researchers in Nigeria were teaching the Billings ovulation method to certain clans and tribes in Nigeria that had preference towards having male children due to their cultural beliefs. And what happened is a lot of couples would have many children, female children, before they got that first male, and it became unsustainable for them. They couldn't feed all their children, etc. So you can read about this, but basically through the timing of using the Billings ovulation method, couples were able to pre-select gender prior to intercourse with a high level success rate if you're very good at tracking your menstrual cycle. Next slide, please. The Creighton model builds upon the Billings model. It uses some biomarkers and some more modern science, this can also be used as a form of contraception if you get the adequate training. Next slide, please. And the 2-day method is a more simplified method which was developed by the Georgetown University Reproductive Institute of Medicine, where a woman basically asks herself 2 questions every day. Am I experiencing any discharge today? Have I experienced any discharge yesterday? If a woman answers yes through either of these questions, then she's deemed fertile, and you need to abstain from having intercourse. If she answers no to both, then she's considered infertile. And this has a high success rate if done really well. Next slide, please. And now I will leave it to Tracy to talk about the lactational method.